Good evening, friends. Welcome to this 60-minute session on improving your case conversion, patient conversion, or case acceptance ratio in dental clinic. I hope we are live right now. Just let me check, then we can start. Not showing the notification, but I hope we are live. Okay, never mind. Let's start the presentation. So friends, welcome to this improving your patient conversion or case acceptance dental clinic. We all have been witness to various scenarios where we encounter so many OPDs cases in a day, and we rarely ever keep an account that how much patients have actually walked in through the door and actually got converted through our acceptance, or you can say our effective first consultation or second consultation, whatever way. The patients who choose to get the treatment done from us. So those are a few things which will actually be very important in gauging the success metric of any practice. And trust me, these are a few things which are going to make a lot of difference in our routine, you can say, private practice. Because whatever case acceptance we have, it does not make any difference that what you number of patients you see. Effectively, what patients choose to get a treatment done from you, only those are the ones which are going to make a difference in your practice. So I hope uh, we I'm able to delve some good points about that tonight in this presentation of 60-70 minutes or so. So let us begin the presentation. All my presentations will always begin with thanking the Lord Almighty who's given me much more than what I deserve. So today is the auspicious day of Ganesh Chaturthi. The Ganpati comes home for the next 10 days, and it is going to be a very, very, you can say, fruitful period for all those who have brought him home today. Along with that, it is almost the end of Prayushan for the Jain community. So it says it is Michami Dukadam as well. In this, you can say, the pious end to the holy period of Prayushan for 7 days, which the Jains usually keep to purify their soul. So you are all aware of my biodata. So just to let you know a little bit about what I'm speaking today actually deals with what exactly, you can say, I did in marketing management and in my hospital management. You can say qualifications a few years back, about 12-13 years back. So again, this is again one of my published books on practice management, one of the 5 books that I published with Lambert Academic Publishing last year. My clinic versus my life, what is my priority? 51 practical tips on management, practice, and life. So I've been delving some tips in my daily webinars as well. So let's begin today's topic, patient conversion and case acceptance. A little bit of this part has been taken in my earlier presentation on improving the conversion ratio. So today's part will be converting, you can say, adding on the case acceptance part as well in this presentation. Of course, I'll be giving a few tips on that as well. So this is the topic for today, improving patient conversion in a dental clinic, because case acceptance is the key to big numbers. So this is my MPG group webinar number 43. I keep on taking my webinars for my free groups and my paid groups. So this is number 43 for 2021. So the paid group has its own number series. So let's begin today's presentation. We all know that dentistry, or for that matter, all the parts of healthcare, they are actually very, very competitive these days. You can't actually let your guard down. And trust me, all those things are going to play a lot of role in our mind. We are very much really bothered about what comes into our practice. And of course, we rarely bother about what goes out sometimes in forms of expenses. But then expenses is a matter for any other day altogether. Today, we are concerned mainly with the input part. You can say what walks in through the door. The first of all, I would like to dispel this myth that what most of us believe and most of us, you can say, feel bad about sometimes, that we are actually not really, you can say, very calculative or methodical about realizing this thing, that not everyone patient that walks through our door is our patient. There might be many window shoppers. There might be many second opinion patients. There might be certain patients who are just here to check you out if you are newly opened up. So there are many, you can say, ways the patient has walked in. So don't assume or presume that everyone who's walked through is your patient. Trust me, dentistry these days has a lot of competition. There, in 1 square kilometer of every city, there are close to 10 to 15 dentists almost in every town. Leave aside maybe tier 3 or tier 4, a few areas scattered all around. Maybe they are the lesser explored areas, but tier 1, tier 2, maybe more numbers than this as well. There is a lot of competition. There are a lot of alternatives for every procedure. There are a lot of professionals willing to compete and complete those procedures for throwaway prices as well. But yes, there are so many who work on their norms, on their notions, on their pricing, on their, you can say, systems with a proper protocol. Excuse me. So, but they don't let their guard down in that sense. So the thing is that the access of information has been dirt cheap now because of the fall in internet prices ever since Geo actually exploded into the market. The civilized human population used to pay 250 rupees for 1 GB. Now we get about you can say almost at the cost of 6 rupees or 5.5 rupees per day. We get 1.5 GB free every day. So it is like exploded like anything. So the thing is that has actually caused to remove the barrier between the information input and what the patient wants to actually ask you. Whatever opinion we give has to be verifiable. That is a done thing because the patients have too many places to verify that. So then the only thing is that we actually have never been able to inculcate the marketing formula. The marketing formula is the characteristic Yeda's formula, AIDS: attention, interest, desire, arousal, and satisfaction. Oh, sorry, acceptance and satisfaction. So that is the characteristic Yeda's formula, which is prevalent in the marketing industry. We actually, problem is that we don't feel that dentistry is a business. We always say it is a noble profession. I believe that yes, it is a noble profession, but at the end of the day, if you have an income and expense somewhere, it is going to be a business only. So the patients call the practice to schedule the consultation. They come in and they actually are recommended a procedure. Whether they want it to be done or not is the one thing which we are going to discuss today. And that is only related to the case conversion, patient conversion, or the case acceptance. And I'm not talking about the general walk-in about maybe a filling or two or a oral prophylaxis or a scaling, which we can say. I'm talking about the medium to big ticket cases here. Of course, those small things are also important. If some patient has walked in with a small cavity to be filled, he may be having many other problems. How you go about the task of conveying is an art about that. Some people are not bothered about. They say the patient has come for a problem, we'll solve that problem, the patient walks away. The only thing is if you don't convey the patient the desired needs to be fulfilled, you can say the patient may have a lot of needs and wants. The needs may be related to chewing purpose, occlusion purpose, or maybe any other thing which is hindering the patient's bite. But on the flip side, there might be wants. The patient might not be happy with the smile. He may have a little chipped off tooth, maybe a crooked tooth. So what exactly we are going to do with that? So if we are not informing the patient about the needs and the wants, we are actually faltering somewhere. We are actually, you can say, not allowing the patient to get converted into our practice. And that is where the problem comes. So once you understand those things, you are going to do an effective consultation. So once you do effective consultation, that is going to make or mar your practice. Because trust me, people believe that we did an honest consultation, but the patient still didn't get converted. We offered him the lowest price in our area. Our competitor is offering this much price. We offered a different price. We offered a lesser price, but still the patient didn't get converted. What was the reason? Is it related to price only? I would say no. Why would I say no? Because ask any female. If you say, I'll give you 5-day-old fruits at 1/4 the price, 100 rupee fruit at 25 rupees kg, but they are 5-day-old. Will you buy it? She would say no. A male would still buy it. Maybe he may buy it out of lack of interest or out of lack of knowledge, you can say. But a female would never buy it. That is why they say specialist for the specialist job. If price was the criteria, why was Tata Nano, a 1 lakh rupee car, the most unsuccessful car? Whereas if the price was the criteria, coming from a branded company, branded house like Tata, which uses Jaguar parts in its cars, everybody knows that. Why was Tata Nano unsuccessful? If price was the reason, Tata should have been, Nano should have been the highest selling car. It's not. So we still wonder if the patient was given the lowest price. Somebody is doing, let's suppose, just presume, if somebody is doing a crown in an area for 2,000 rupees, you offer it for 1,800, but still the patient did not want to get the treatment done. So what is the reason? Have you ever wondered why? So the reason is that we are actually made to think that maybe he's not using good materials, because everything is going costly. I got my last crown done for 2,100. This doctor is, I came to him for the first time. He's offering the same crown to me for 1,800. When the petrol has risen to an unprecedented level, when the other cost of living have gone up, how can this thing come down? So he's not using an authentic thing. We don't even bother. We fall in that herd mentality to actually, you can say, look out for the cheapest thing, the cheapest price, which is actually wrong. So this thought primarily would come that everybody witnesses so many things, and they would say that yes, probably these things are not very cheap these days. So the patient experience has to be the key. It is not about the pricing alone. What the patient comes into your practice, he sits there, observes a few things, inhales the air, the moisture, you can say the atmosphere, the positive vibes, the aroma of your medicine, the aroma of whatever you are actually using in your clinic to spread a good fragrance. Little bit of example. So those all things make him actually make a perception about you, and he may have walked in a certain expectation, that perception part of how you treat your patients. How much is your waiting time? How much is the staff behaved? How much are you acknowledged immediately on arrival? All those things. Were you offered a glass of water, or were you offered the consolation about what time are you going to wait even after an appointment? All those things are going to make a little bit of difference before the patient actually gets to see you. So these also form a part of the patient experience. So always learn to think via the patient's mind. We do just the pricing. We do the lower part of the price. And trust me, I have a quote for that. Insecurity stems from the infertile mind. We are insecure that if we offer a higher price, the patient will run away. No, if you decrease the prices, the patient might actually run away then too, because you never bothered to ask what was the earlier treatment done at what price from whom. The patient walked in with a certain amount of expectation. You could not create that perception. The partial perception was there when the patient was made to wait long. The staff did not acknowledge them. The staff didn't greet them. They just did not offer them. I'm not saying that that is going to be the most mandatory thing, but yes, the insecurity of losing the patient actually weighs heavily. Where will the next buck come from is the biggest dilemma every dentist has in his mind. We all believe that इस महीने का तो अच्छा हो गया, अगले महीने पता नहीं पैसे कहाँ से आएंगे. We fail to realize certain aspects that Nobody has a FD of patients that he will go next month to the bank and get that FD premature breakup or just FD normal breakup done and get patients. Of course, that is on the lighter side, but nobody has that fixed OPD of patients. Maybe somebody would have a 1 month of waiting period in his appointment. India, we don't follow that much amount of waiting period. In foreign countries, you see 6 months of waitings, so 5 months of waiting. That is a common phenomenon. In India, even the most of the busy practitioners would not have more than 2 to 3 weeks appointment. I I don't think any patient would wait for that much amount of time, even if it is a big hot shot, unless of course the situation of the patient demands it. Somebody walks in for a root canal and you say, I am very busy. Come to me after 3 weeks. I'm giving you an appointment. Today is 10th. I'm giving you an appointment for 1st of October. After 3 weeks, will the patient wait? No. He said, I can't wait for 3 hours, 3 minutes. You asking me to wait for 3 weeks? I'm sorry. I'll choose another guy. So all those things form a part of the patient experience. So this is not the only factor which we actually think that the pricing. We actually have too much assumptions and arrogances. You can arrogance also done in our clinical scenario. Uh, there are actually colleagues who believe that every patient walks into our door is converted. My conversion is 100%. I can challenge anyone. Nobody has that. Nobody has that percentage. So you can't actually believe that whatever the you can say the colleague says. There are a lot of factors which actually affect the practice conversion rate. It can be external marketing. It can be the skill with which the staff deals in internal marketing, your total of patient experience, the patient absorbing of the internal environment, how you talk with the patient, how you deal with the patient, how you make him understand the treatment plan, how you convey him what you're going to do, how you're going to do, what is your policy and procedure, how are your terms and conditions to the patient for the payment wise, the convenience factor. All those factors in unison make a patient select you. Yes, there may be occasional situations when the patient will choose you for come what may. Whatever you say, if you even say, I'm going to place a PFM for a 10,000 rupees in a tier 2 city, tier 3 city, the patient says, I have blind faith on you. Do whatever you want to, I'll pay you. There may be occasional scenarios, but rarely the blind faith scenario works in today's times in majority of the cases. So all these things do make a difference. Do you know what is the ideal patient conversion rate? Have you ever calculated? The perfectly ideal ratio in Indian conditions is 7.2 or 72 out of 100. The minimum acceptable is 4 out of 10 or 40 out of 100. The average healthy one is, I would say, 5.5 to 6 or 55 to 60. So if somebody who falls in the range of 55 to 72 is having a great ratio. People say I have a ratio of 80%. Fine, perfectly all right. You are doing much more than the perfect or the ideal one. But there are patients who will say, there are colleagues who will say, I have a ratio of 30 to 35. Do you know what is the average ratio of US dentist conversion ratio? You'll be shocked to hear, because they calculate from whosoever calls in their practice, whosoever mails them, whosoever books, who just is a lead, because the external marketing is openly allowed there with the offers in the American subcontinent, of course, in many European countries as well. So they talk it from the lead purpose, whatever leads they have. So from that, their conversion with the patients who actually got the treatment done, that percentage on an average in European and American subcontinent, predominantly USA, is 23%. Hard to believe, but yes, that is the industry norm. Anyone having above 23 is considered to be doing very good. But as I said, they counted from the lead generated totally, from the total external marketing, right? From anyone, even if anyone calls for a journal inquiry over the telephone, they count that as one patient who inquired. So out of those inquiries, everything, the conversion ratio is 23. I would say not bad in that sense. So the first thing is that you understand what your current conversion ratio is. Unless you know where you stand out of this, then only you can calculate that, yes, I have to improve my conversion ratio. The whole reason for attending this webinar would be then and there only, if you are able to understand and set some realistic expectations about you. Because unless you know where you are, you can't reach or you can't go where you want to go. So it is you can say a process. It is not a one-time event. It is a process. And as you move on, you will go on setting higher benchmarks. And of course, the primary thing involved in this is a good consultation, spending some time with the patient. Unless you spend some good time with the patient, you are not going to actually realize fruits. Patients are not to be, you can say, they are not to be hurried away these days. They have this common problem that dentist does not listen to us. Dentist does not give us the required time, or any, not the dentist, maybe the general doctor as well. But if we give them the accorded time, we listen to their all the problems empathetically, offer them a solution that we have, and of course, if those things are acceptable to them, then only the case goes ahead. And this process is optimized every now and then. You do conversion rate optimization like a process. It is not a one-time event. So always challenge your assumptions and keep pushing yourselves, because unless you keep pushing yourself, you are not going to achieve bigger success in that regard. So for increasing the patient conversion rate, what exactly is required, you can say? Because if you want to increase your case acceptance or the patient conversion rate, that all boils down to creating a good patient experience. And unless you give the patient a good experience, the same is not going to be converted. I wouldn't say the conversion happens at the first sitting only. The patient sometimes might, for a big ticket or a medium ticket case where multiple things are involved, the patient might come to you for 2 to 3 sittings before actually saying a yes. And all those sittings before the consultation, where the patient tries to actually go through what is to be done, how is to be done, which is the sequence to be followed, what is the costing involved, all those doubts. The patient has every right to ask a question, and we have all the duty to answer all those questions satisfactorily to answer that. But then for all that, you need time. If you are too busy, you can say in your, and too bogged down in your OPD, that you don't have just the time to look up what exactly is happening around you, you'll miss the forest and the trees, as goes the common proverb. So what exactly is required? Improve your scheduling. You schedule a patient for a consultation. You already have 2 patients walking in. So you're going in from your consultation area to your patient, doing some procedure, coming back, talking, going there, coming back. This is not going to set a good example to both of the patients. You have one converted already in your chair, and one is sitting in your waiting to be converted. You might lose actually both of them. So you were in a pursuit to improve your conversion ratio. You might actually lose the one in the chair as well. A bird in hand is worth 2 in the bush. The consultation area is 1 in the bush. So once you have that patient in the chair, I always say satisfy the patient with the 3 E's, with your job, with the 3 E's, effectively, efficaciously, and efficiently. Unless you use those 3 E's properly, the resultant satisfaction for the patient in chair will not be there. And if that is not there, he is not going to give you a referral. And if he's not going to give you a referral, then he cannot be a brand ambassador. Then how are you going to network further through your patients? And similarly, for the one you have called for an appointment, he wants a dedicated time. Of course, you can charge for that time after calling them. Let them know this is my case discussion charges. These are different from my consultation charges. We want to sit, I'm going to give you time, whatever you want, 30 minutes, 1 hour, but this is going to be the time. But yes, of course, many people do it. They say we'll charge for the case discussion. And if the patient says yes, that money is adjustable in the treatment. We all know, we all can do certain things and then adjust the same into those parts. But yes, what is important for the patient who's in the consultation area is improving your scheduling, how you're going to work. If the patient says, I work only from half day, I don't work in the evening. The patient says, I am working in the morning, I can come only in the evening. So matter closed. Evening, I go to a different clinic. That clinic is far away from me. I want to get it done from you. You are not here. Your associates would be here. Some people have multiple setups. Yes, sometimes it is necessary, but sometimes it is just out of fashion. I know a colleague who is in my group. He goes to 5 clinics, and one of them is charitable, but the rest 4 are his own clinics. I ask him, boss, how do you manage 5 clinics? I can't manage even 1 properly. How can you manage 5 properly? You're paying different area, different rent, different staff. How are you managing it actually? How you're actually, and if they are at a close distance to each other, it does not make any sense. If they are at far distance to each other, you're actually spending a lot of time in traveling each day. So why don't you consolidate? सर नहीं सर, वो 2 दिन मैं इस तरह जाता हूँ, मैं 2 दिन इस तरह जाता हूँ, वो 2 दिन मैं शाम को जाता हूँ. सर मेरे को नहीं समझ आई, आपको भी याद नहीं रहता तो पेशेंट्स को कैसे याद रहेगा? The patient knows the doctor comes 2 days a week. Who is free? Why would the patient choose you when he has a dentist at his disposal for 7 days or 6 days a week? Why will he choose you? Unless you are very, very special, which is not possible for all the patients to presume the same for you. So you need to understand that your scheduling has to be impeccable. In that sense, that you should be approachable and available for the patient. Of course, does not mean at 12 a.m. in the night. Patients, I have told many times, I belong to a business city. My city is a hosiery and a cycle industry famous. We are a very laid back city. Our businessmen go to the factory at 11, come at 10:30 in the night. So what exactly do we fulfill by that? Nothing. They want हमको रात को 9 बजे का टाइम दे दो. सॉरी, सुबह आ जाओ 9 बजे. आई विल बी हैप्पी टू अटेंड यू. सो नहीं सुबह तो फिर मैं उठता लेट हूँ. It is your choice. What do you want to do? If you want to get a treatment done from me, you will have to actually go as per what I want. But if you are willing to actually, you can say, willing to go your way, then you better choose another dentist or don't get the treatment done from me. So that is the thing you need to understand. Then the consultation appointment, when you have given an appointment to the ongoing case, it has to be really spread up in a sense that the patient gets a dedicated time. And yes, once you promise something that we are there for you, once the treatment is done, you make a sale, you don't give a service. In business language, if I speak crudely, you are actually faltering upon your promises. The patient is not going to come for the same. Remember, you make so much of efforts to make the patients come through your door. Can be a lot of external marketing involved, can be a lot of networking involved with your local shopkeepers, your local clubs, your rotaries, your whatever events, to tell someone that yes, Dr. So-and-so, Dr. Ahuja, Dr. Sabyasachi, Dr. Divya, Dr. Sanjay, Dr. Harshada, all those group members who are along with me now, they are actually available. Yes, we are there to serve the society. Of course, serving not free, of course, at a cost. But yes, once the patient walks in through the door, the external marketing ceases to act. That is one thing you have to understand very, very clearly. No amount of external marketing done to that patient is going to serve any purpose. This is similar to a Bollywood movie. The Khans, the 3 Khans, Amir Khan, Shah Rukh Khan, Salman Khan, Hrithik Roshan, and Akshay Kumar, Ajay Devgan. These are all crowd pullers, A-listers as they are called in Bollywood. What is their main attraction? Star power, face value. They pull in the patient or pull in the audience for the first 3 days. Again, I'm talking of the normal times, not the COVID times. They actually, you can say, they fulfill their events. Their purpose is to actually go through the task of the same, of pulling the audience for the first 3 days. Once the audience is pulled in 3 days, it is not going to serve any purpose beyond that, because once the audience is inside, they are going to actually, you can say, merit the movie on the content. The face value diminishes over there. So once they are actually done with that, the face value will diminish. So the content does the talking. The face value can pull in the crowd maximum on Friday, Saturday, and a Sunday, but not beyond that. Monday onwards, the content does the talking. These days, the movie, of course, before the COVID times, I'm talking. These days, the movie is killed before, you can say, because of the advent of social media, because of that. Just give me a minute, please. Sorry, guys. So you have to consult those things in those sessions, that it is not the time to do about those tasks. So Monday onwards, the content will do the talking. The face value is not going to pull in the crowd. So that is the thing you need to understand very, very clearly. So similarly, you have done external marketing. it is not going to actually do any favor to that patient who has once walked in through your door. It will not act the second time. He already has made a perception of you if he is a disappointed one from you in that regard. So that is the only case scenario where we can assume that external marketing will cease to act. And once the patient comes inside, the internal marketing takes over. So the internal marketing, when it takes over, the patient gets to see what you actually offer. And what you're offering will always be a similar situation, which will hold good for the patient in that regard. So remember, external marketing would be over. Internal marketing is what you offer in the service wise, and it is not only the treatment wise. Treatment comes much later. What you talk to the patient, what your staff does to the patient, what the patient sees, your cleanliness of the clinic, your way of working, your SOPs, your staff making them wait, you can say escorting them, your n number of things which come before the patient actually gets to talk to you. That is the thing you need to understand. So these are a few things which you need to remember. Then always important is that you don't go on the cheap. If you have to go in for a staff member, it can be associate, it can be an assistant. If you're hiring someone who is skilled, of course, this line goes in mostly for the associate staff. If someone impresses you with a skill, try making him a man Friday or a woman Friday, or you can say the right helping hand. Don't go cheap on them. So when you get that personnel with skills, don't actually, again, if someone skilled is there, not on your new patients. Make a flow chart, make a system. Who talks to the patient first? What is the way you deal with the new patient? What is the flow of the whole procedure like? That should be conveyed. Again, for that, you need a proper SOP into your practice. So have them do something easy first, and then you can actually guide them. The best way I always say is whatever you explain behind the patient, that would be important. But what exactly you can do with the patient, during the patient, I call that as OJT, on-job training. And that is very important in that regard. So once they have a grasp of how to handle, put them into tough situations. Obviously, these are all for the associate staff. So then coming to the assistant staff. So especially if you're having a receptionist system, the attitude is a big key. The receptionist has to spend a lot of time with the patient. The receptionist has to do a lot of work in terms of medical history, the screening part, the payment part, calling of the patient, scheduling of the patient, answering the calls, answering the complaints, giving the instructions. They are like a gatekeeper as well. They have to be like a plastic smile at least on their face all the time. So they have to attend those things multiple times. So this ought to be like you can say a gate man and a friendly, welcoming person from the communication point of view. So their attitude really matters. Somebody talks in rudely to the patient. Somebody tells the patient, sorry, we are very much busy today. We don't have time. So that is going to actually flow in a wrong sense of message to the patient, that they have a real big attitude. The dentist, I took an appointment from the dentist knows me. The staff does not let me meet him or her. So you need to understand that whatever you do, the first face of the clinic is sometimes the receptionist. If you are at all using, if you're not using, your inside staff or your other as assistant staff is handling those parts. Make sure they are cordial and warm enough. Their home problems should not be carried forward into your own practice. So then there is a direct ratio in the quality of communication that you do. So what the length of time you spend with your prospective new patient and the patient percentage that converts. So spending some quality time is very important for getting the conversion. So the longer you spend the time clearing the doubts, the higher the conversion percentage is. So let me give you a few perfect strategies how you need to actually you can use that time effectively in terms of case acceptance. You can keep the consultation simple yet glorified. Of course, you need to do the alternate I and E, inform and educate the patient as well. But at the same time, you do not have to bog down to patient suggested or Google suggested treatment plans by the patient. You have to be authoritative and call a spade a spade. You can't actually, you can say, agree to what the patient wants all the time. So always avoid using a complicated and a scientific jargon. Use a simplified terminology, especially when you're going to document those things in your consent form. You have to use a very, very simple language. So always you keep your patients engaged and motivated via stories, via anecdotes, and via certain instances of your previous patients where you can actually make them connect to you better. And again, do not simplify it too much that they will feel that ये तो मुझे पहले ही पता था, इतना बता के उन्होंने टाइम वेस्ट कर दिया, ये तो मैं गूगल से पढ़ के आया कि रूट कनाल कैसे होती है. आई डोंट नीड द रूट कनाल, आई नीड टू नो रूट कनाल चलती कितनी है, रूट कनाल की कॉस्ट कितनी है, इसके ऊपर क्राउन लगेगा कि पोस्ट एंड कोर होगा कि डायरेक्ट रेस्टोरेशन होगा. सो दोज आर द थिंग्स द पेशेंट नीड्स टू अंडरस्टैंड वेरी वेरी क्लियरली. सो दैट इज द वे you can say build your trust as an expert. Certain credibility can only be lent to your voice, your consultation, if you are actually engaged and involved and simple yet authoritative. You can say classy yet very dignified. All those things have to be working in unison in that regard. So then the second suggestion would be to create marketing funnels. So identify what information you need to provide to your patients when they are in the customer journey. For example, I just said right now that simplify your content too much. So I gave an example. The patient doesn't need to know. You ask them, do you know how a root canal is done? Yes, I have seen it on Google. Do you want any clarification on that? No, I don't want. I know that. Just tell me the other parts involved in that. That is a polite way to end the conversation in that regard. But sometimes in our attitude or arrogance, we try to simplify. रूट कनाल में हम ऐसे करते हैं, इसको हम साइड से करते हैं, हमारे साथ के डेंटिस्ट ऐसे करते हैं, लेकिन हम इसको ऐसे यूज करेंगे, फाइल को ऐसे डालेंगे, हम मशीन से करेंगे, मैनुअल नहीं करते हैं. ये हमारा ये टेपर इंस्ट्रूमेंट है, ये हमारा टेपर है, ये हमारा वार्म गटा पर्चर टेक्निक है, हम उससे यूज करते हैं. पीपल गेट टू मच सिंप्लीफाइड सर्टेन थिंग्स और ग्लोरीफाई सर्टेन थिंग्स. You have to ask the procedure. Those are the variants of the procedure what you are offering. The patient didn't ask for it. You go about that information only when it is asked. So identify those things if the patient is clear about root canal. But if he wants the information, then you can go ahead on that part. But no, then go. But as you already know about the root canal that we are going to do, but what are the pitfalls? In this case, I expect you to go in for a crown as well because your tooth is proximally broken. I'm not really sure whether, and it is slightly close to equigingival margins. I'm not really sure. Again, you have to simplify these things. Your tooth where the tooth is ending, or you can say where there is a ditch, it is ending close to the gum line, and where we might not be able to actually fill it properly, nicely, giving it a contact. There will be a certain kind of void over there. So we need to maybe give it a crown. I'm just giving an example. Don't assume and presume in this scenario. But what I'm trying to give you is an example that you can skip the much needed ones. People actually use the same information in their consent form also. I've told many times you don't need to give the procedural details in that, because sometimes the consent forms, if they are made in an elaborate manner, go up to 4 to 5 pages. What system I advise is, in that sense, the consent form will never be beyond 2 pages. Rare case scenario, complicated case, 2.5 pages maximum, but otherwise not beyond 2 pages. And in that, you can finish the whole treatment. The patient has been explained about the treatment, how it is done, and the patient says, I have understood it fully. That is the way the root canal is done. In this, the tooth has 3 layers: enamel, dentine, and pulp. When the decay crosses enamel and dentine, all those technical things are not needed in the consent form. If the patient, even in the verbal consultation, the patient asks for it, then only you provide those things. And obviously, time is precious for everyone. It is not only the patient says that the dentist should spend some quality time with me. वो होता ना, टाइम तो आधा घंटा लगा दिया, बात ढंग की एक नहीं बताई. Similar to many people who do it in this sense. So it is always better that you develop a marketing funnel where the patients, you can say, will have the questions. You do a role reversal, role play, where you sit with your staff, sit with your associate, and actually decide that what exactly is going to be your question, and you are prepared, or you should be prepared with your answer in that sense. So this is an example of a marketing funnel. Of course, it begins in a different way, like a lead generation, lead nurturing, and the sales. So similar to the YEDA's formula: awareness, interest, consideration, intent, evaluation, and purchase. So This is like that. What stage the patient is, you have to really judge that and then advise accordingly. The sales funnel is also like a similar thing. It is a variant of the marketing funnel only. Awareness, consideration, purchase, retention, and advocacy. And similar way, attract, convert, engage, sell, connect. So this is the way you actually, but what is important is that in marketing, the funnel completes till the purchase or the sales by your, once you make a sale, it is there. In our case scenario, it does not finish at the sales, because with our purpose, the service comes free of cost. The service does not mean that you are going to attend to every complaint free of cost in the future. Free of cost means you are there for the patient in that regard. That patient needs you, not always in the middle of the night, but you are there to solve the problems, albeit at a cost. Everybody understands, or at least you have to make them understand. If they don't understand that if a crown is bonded, it does not mean that it is bonded for life. You have to give the information that it is, you can say, cemented or bonded for a certain period of time. If you don't convey the same to the patient, and if the patient, you can say, bombards you after 2 years, ये तो crown 2 साल में निकल गया, आपने तो बोला था 8 साल चलेगा. Did you explain the crown life separately or the cement life or the bonding life separately? If no, then you are at fault. You have to explain them that the bonding life or the cement life is this much, the crown life is this much. Both are different. Don't throw away the crown. Whenever the crown loosens up, report to the clinic within 24 to 48 hours. Inform us, we'll guide you, and the same will be bonded back again in this much time, and this will involve little bit this much amount of cost. What does it take? Hardly 30 seconds to convey, but people don't convey it, and that is where the problems come. ये डॉक्टर बोलता कुछ है, बाद में कुछ है. पहले कहता चिंता ना करो. People give guarantees of 25 years. A patient came to me yesterday only. He said, my dentist said your crown will last 25 years. I said, how old is he into practice? He said, I don't know, but he was just 2 years old into practice at that time. He was opened up just 2 years before. And how much time before? Just about 7-8 years. So means now he's 10 years into practice, and he is given a guarantee till 27 years of practice. Was he sure that he will carry on practicing till 27 years? I'm not sure. I'm into 22nd year of my practice. I just turned 45. I plan to wind up till 50, at least partial practice. I can't continue because of my back injury. I may not be able to continue for full 8 hours as I'm doing. I already set the benchmark at 40, then 45. Now I've pushed that back to 50, just to give you an example. But at 50, I've surely decided that I'm not going to go beyond at least half a day schedule to actually, you can say, further elongate my other life, which is there. I'm not living a dentist life only. I have other life also. So I want to prolong that life also for my family, for my own journey, for my own game. So just to give an example, I will be 27 years of practice in another 5 years. And that dentist at second year has told that I'll be at 27 years. There are so many professional hazards involved in dentistry. The neck and the back issues. We all know that. Somebody who does a practice for 25 years plus has really done a great deal, I would say. And not many complete 25 years of practice. We can look back and say our old dentists of the town, they're still doing, but then they are doing out of their need. Maybe they are not planned well. Maybe they have not saved well. Maybe they are doing for some other reasons. Why do we need to do that? So if you are having high conversion rates, there ought to be certain reason. It has to be the strong dentist and patient relationship. And this is the patient and the practice of the patient and the dentist connection, which actually keep them bonded. It does not mean keep the family relations with your dentist, with your patients. Of course, certain patients you will have very close. They will get very close to you. Nothing wrong in that. But I always advise to keep your personal and private life separate. Many patients invite me for their family functions, for their son's daughter's wedding. I'm happy to go. And of course, offer my blessings or my best wishes to them in cash or kind, whatever I want to. So out of regard, if they invite me, it does not mean that I have to invite them back to my own family functions. It is a personal choice. The relationship does not sour because of that. So we need to maintain a certain barrier because of that. So how I have told you the base of the practice conversion, the case acceptance. I'll give you a few tips now, which are going to come handy for you in today's time. So tip number 1, effective listening and inquiry. Because the only thing is we are happy to speak and speak. We always are happy to actually अपने गीत गाने में हम मसरूफ रहते हैं, जिसको बोलते हैं ना हिंदी उर्दू में. So हमने ये किया, this is my case, I've done this, I've done that. The patient knows it, yaar. The patient has chosen you because of that. You are a good dentist, that is why the patient has chosen you for the treatment. But उसकी प्रॉब्लम तो सुन लो. पेशेंट बोल रहा है मैं ना ठंडा पानी पीता हूँ, हाँ वो ठंडा पानी पीने से रिलीफ मिलता है, वो ठीक है. लेट हिम कंप्लीट. ही माइट हैव बीन वांटिंग टू, वो ठंडा पानी तो पीने से ठीक रहता है, गर्म लगता है मुझे. मे बी वांटेड टू स्पीक दिस. यू कट शॉर्ट ए सेंटेंस. Always have the space between your 2 ears to absorb. Always try to listen. Even if you are a genius, even if you are a university topper, listen. There is one mouth and 2 ears for a reason. And if they are there for a reason, you are to justify that. Tip number 2, people will have a sales approach only. As I just said, the marketing in the sales funnel does not tell you that you also adopt that. Yeda's formula adoption is good, but the Yeda's formula for us does not finish. The service has to come with that. Of course, at a cost. I'm not saying it, but just to people work on this phenomenon. Patient मेरे clinic के बाहर, ना मैं उसको जानता हूँ, ना वो मुझे जानता है. This is a sales approach. Don't do that. Don't do that. You are like हम लोग patient या उस तरह दूसरा approach ये होती है. People try to push their patients. They have done one procedure, the patient is satisfied. You've gotten the other procedure की दूसरी side पे missing दांत है. You convey the patient, you inform and educate. Yes, this is there. You can get in, go in for an implant or a bridge or whatever suitable to the patient. The patient is okay. I'll think over. I'll make up my mind. I'll decide then. Then we call up after 3 days, 5 days, 7 days, repeatedly, multiple times. हाँ जी, आपका क्या विचार बना? You're not going to sell a car, boss. You are in a noble profession. Maintain a dignified approach. Then tip number 3, selling a treatment plan has to involve a certain amount of apathy and urgency as well. Sometimes you have to create a need. Somebody walks into you and gets 2 root canals and a crown and 2 crowns done from you. Maybe a single root canal and a crown done. Let's suppose you're charging maybe 9 to 10,000 for a normal rotary root canal and a PFM crown along with core or a post-in core, 9 to 10,000 rupees. And let's suppose you're charging about 1,000 for a composite. So as a part of your duty, you have to inform the patient, yes, you have another 5 or 6 cavities to be filled up. Those may be in initial or middle stages, but definitely doesn't seem to be a root canal. Even if you are 100% sure, even then choose your words very carefully. They don't seem to be a root canal case, because you never know. Sometimes a deep cavity will have just a pulp horn exposed. Obviously, we'll say we can do multiple things like a DPC or a IPC, but you can't really be sure. So bite as much as you can chew. So always say this thing. But then if we conveyed, ये आपके करने वाली है फिलिंग, आप करवा लेना इसको, भूल मत जाना. This is not creating the need. The creating the need aspect comes mathematically many a times. You can always say, I've done this treatment. You have paid me 10,000 rupees for this one tooth. You have 6 similar teeth on that side, which are right now not in the case that you can pay me 60,000. But yes, if you delay it by a certain time period, that time period cannot be predicted. I will be very happy to receive 60,000 rupees from you. Maybe more if those happen. Maybe with inflation, the treatment charges will rise as well, as everything is getting costly. So those will be costly as well. So I will get 60, 65. But if you get it done now, they might be solved at the first stage itself. So might be your charges now should be close to 6,000. So if you're happy to pay me 10 times more, I'm more than willing to do it. Trust me, India mein maths sabko samajh aata hai. So if you try to go a mathematical way, you can always presume that patient, the need has been created. You can always say that the cavity can become a root canal. उसमें बताइए दांत की 3 layers होती हैं, enamel, dentine, pulp, all those stories you can cook up. Not cook up means you can convey it in a cooked manner. I'm not saying that you cook up a story. That is actually a fact. But what I mean to say is that you can cook up the scenario in that case. that 3 layers होती हैं, यहाँ तक हम fill करते हैं, थोड़ा और चला जाए तो liner और base दे देते हैं, सैंडविच टेक्निक कर देते हैं, थोड़ा और नीचे जाएगा तो हम पल्प में पहुंच जाते हैं और हमारा 10,000 का मीटर काउंटर बन जाता है. Even if that tooth needs a direct restoration later on, that is a secondary thing. But what you have done is smartly created the need. So don't just go in for selling blindly. Always create some emergency, because anyways the patient is going to thank you that you've saved him 54,000 rupees, of course, maybe more. So this is the way actually to get a better conversion. You have not adopted any unethical way. You have not done anything wrong. But what you have smartly done is eliminated all the decay from the patient's mouth, made him aware as well, and saved him a lot of bucks and time, of course. So the patient will feel thank you for you only. And they understand कि आप इसमें पैसे नहीं बना रहे हैं, प्रॉब्लम तो है ना, वो बढ़ जाएगी तो आप वो ज्यादा पैसे देंगे. This is the mindset you need to convey. So tip number 4 is, again, as I said in tip number 2, don't be a car salesman. If you force your patients to accept a treatment plan before they are ready, they'll be less likely to trust your advice. बार बार फोन करेंगे, बार बार वो करेंगे, तो they will realize that ये ज्यादा push कर रहे हैं. There might be something wrong. There might be something fishy. India is a country full of doubtful people. We don't know which temperament anybody possesses. So use a push but pull strategy. Let the patient be pulled back to you with your treatment done on this side, with the 3 E's I've already mentioned, and let the patient come back to you himself. Doctor, आपने बोला था इधर मिसिंग टूथ है, इम्प्लांट है, ब्रिज है, आप मेरे कर दो. आपने बोला था साइड इफेक्ट्स हैं, सुपरारप्शन है, पेरियोडोंटल प्रॉब्लम्स है, मीजियल ड्रिफ्टिंग है, एंगुलेशन चेंज होगा, मेरा प्लंजर कस बनेगा, व्हाटएवर माय occlusion will be deranged, multiple problems you said. Can we avoid that? Yes, surely we can avoid that, because you have come right on time. You were not much late earlier also, but you need to understand that you have to come on time for this procedure. So what is there? You know the patient's needs and wants. I always say in practice management, the first thing is know yourself. The second thing is know your patient. And once you know your patient, you will know his or her need and wants. Needs and wants means in terms of cavity, in terms of, you can say in terms of function, wants are in terms of aesthetics. Needs are function, wants are aesthetics in broad language. So tip number 5, every successful salespeople will call up their clients. So we should also find out after the procedure, how are they doing? Nothing wrong in calling once or twice. If their phone goes unanswered, call them twice. How is the procedure? Always ask for a feedback. Those who have been attending my webinars, they know it. I always insist on this one thing. Yes, मैं अगर 1000 लोग से मांगता हूँ, 1400 लोग से मांगता हूँ, आते मेरे पास 10-15 हैं, I don't mind that. It is their choice. I believe no news is good news. If somebody has really something to say, they will say it. But yes, the feedback is the way. Feedback has a great value, and many times I feel lucky and blessed in this regard that I can sometimes see the hidden thing in the feedback as well. If somebody is trying a tongue in cheek, or if somebody is trying to, you can say sugarcoat the criticism, I can sometimes see it. The person does not want to say it directly, but he says it. I am always open to positive criticism. I really don't mind it. Yes, if it is done with some wrong intention, I do mind that. But always take a feedback once or twice from the patient, value it. If a positive criticism even has been done, if a suggestion can be implemented, do implement it as well. And this holds true for your treatment planning also, in your way of working also, in alteration of your SOPs also. Then positivity. So if you are positive, you can say confidence is a must, but overconfidence is the pitfall. So positive hona अच्छी बात है, over positive नहीं होना चाहिए. But I would say negative भी नहीं होना चाहिए, because it is very difficult. You can say the other side is dark and dingy. The negative side is very, very difficult. So positivity reflects in your behavior, strength, and confidence, that you are very sure of your own treatment, which you are going to do. Then sincerity. You have to, how much punctual you are, how much effective you are in managing your time. All these things are related to each other very much. So you can say, if you are not making your patients wait, it reflects on your upbringing, how committed you are, do you stick to your tongue, how punctual you are, what credibility do you carry. हाँ बोलते हैं कोई बात नहीं, आपका ट्रीटमेंट 5 दिन में खत्म कर देंगे, ट्रीटमेंट के लिए टाइम पे आप आते नहीं है, पेशेंट को आधा घंटा वेट करवाते हैं. हाउ विल यू कंप्लीट योर कमिटमेंट? the patient starts doubting you. There starts the seed of doubt. एक छोटा सा doubt का एक सिर्फ seed ही चाहिए होता है, plant बनाने की हिम्मत हमारे सब इंडिया के लोगों में है. We all can do that effectively, you can say, with all the 3 E's as well, of course. Then respect the patient time. If you don't want to, if you can't wait yourself, don't make the patient wait also. And does not apply only to the VIPs, but normal patients as well. And that is the reason I say zero waiting time is one of the biggest practice builder tools, one of the great internal marketing tools, if you believe so. Then resolve your complaints or misunderstandings in a jiffy. Always treat your suffering patients on priority. इसमें मैं भी थोड़ा सा मेरा एक इसमें spiritual angle है. I believe that एक बद्दुआ में किसी दुआ से ज्यादा ताकत होती है. I believe there is a more curse in a suffering patient rather than a blessing by a healthy patient. So always try to treat your suffering patients. Always try to go to the problem that whether the suffering was same because of your treatment or because of something else. It does not make any difference. You have treated the right side and the patient is suffering with severe pain on the left side. And you are already making a statement in your mouth. हमने तो इधर किया था, इधर कैसे शुरू हो गया? You are trying to already guard against your justifications, which you are already making up your mind rather than relieving the patient of the pain. Rest everything comes later. Treat the patient first. Treat the patient, relieve the patient of the pain. That is more important than anything else. We start counting up the patient. आया है, इसके साथ कोई आया है, किस पे आया है, इसकी जेब में पैसे तो लग नहीं रहे हैं, wallet लेके आया कि नहीं आया. We start looking at stupid things like that. I've seen colleagues doing that. I'm not telling it by cooking up stories. I've seen my friends and colleagues doing that. So then, because I have been going for consultation at various places in my initial phase of my career. So I can say whatever you see in my presentations is when I give the examples of colleagues and friends, all those are from my personal experience only. So then tip number 10 is remain approachable. Always call back your patient. Call rates in India are dirt cheap. They are the cheapest in the world. So हमारा ये attitude होता है, हम डॉक्टर हैं, अगर पेशेंट को जरूरत होगी तो दोबारा कॉल कर लेगा. This is a era of datagiri. Call rates are almost down to negligible thanks to Reliance Jio. एक कॉल कर लेंगे, कुछ नहीं जाएगा. आप नहीं कर सकते, आपने रिसेप्शन से करवा दीजिए, स्टाफ से करवा दीजिए. But always call back your patient if somebody has called back or if you have any missed call. So this is the reason you need to understand. Always evaluate a conversion or a non-conversion. पूरा एक्सपीरियंस इनिशियल फोन कॉल से लेके पेशेंट के बात करने तक, वो पेशेंट कन्वर्ट क्यों नहीं हुआ, उसमें प्राइस कहीं नहीं आना चाहिए. प्राइस सबसे एंड में आना चाहिए. कैसे बात की, किसने बात की, क्या कन्वे किया, क्या वो जानता था, क्या उसके मन में था, वो सेकंड ओपिनियन लेने आया था, व्हाट इट वाज, यू नीड टू अंडरस्टैंड. So all those processes where the patient approach is important are going to be handy. Then follow the 3 C's. If you want to achieve success, you have to make a scheduling and appointment system, which is actually, you can say, bulletproof. And if you make that system bulletproof, trust me, appointment scheduling again is one of the biggest practice builders of your practice. And it is reassuring for the patient. Yes, मेरा डॉक्टर सबसे सही है. So what are those? Capture, credential, and close. Let's see. The first step is to capture information about the patient by asking a series of questions. क्या problem, किस तरह की problem, क्या, all those related to how and whys. Let the patient speak. Yours should be short. How, why, and all those. Let the patient speak the majority thing. Don't interrupt. Don't eat into the patient's word. Don't complete the unfinished sentences. Let the patient speak. He might be in genuine pain. He might be in genuine distress. He might need a pause. You might be looking at your watch, looking at your assistant, looking at the patient sitting in the waiting. अरे यार जल्दी बोल यार, मैं लेट हो रहा हूँ यार. If you are getting this kind of attitude, यार मैं लेट हो रहा हूँ, तो consultation रखो ही मत. Schedule it to a further time. If you are in a hurry, never do a consultation. मेरे को यही समझ नहीं आती. Many. I've said this word many times. So many colleagues actually don't spend time on consultation. अरे यार सारी जिंदगी आपको रेफरल से नहीं मिलेगा. आपके पास जो इवन रेफरल भी आया, वो भी ये ब्लाइंड फेथ करके नहीं आया है. वो आपको किसी ने रेफर कर दिया, उसने बोला यार वो डॉक्टर आपकी प्रॉब्लम सॉल्व कर देगा, ही इज अ गुड डॉक्टर. आया यार, मेरे को तो कुछ भी अच्छा नहीं लगा, उसने तो मेरे साथ बात तक नहीं की ढंग से, मैं ट्रीटमेंट कैसे करवा लूं इतना महंगा उससे. The thing is, people will still form their perception about you. They might have been given a certain expectation by a colleague. They might have been pushed into your clinic door. Not external marketing. वो जो colleague जिसने भेजा उसने external marketing कर दी. colleague मतलब उनका colleague, your brand ambassador, your favorite patient, whatever. उसने कर दी, उसने धक्का मार दिया. अब उसको आपने संभाला कि नहीं, उसको बैसाखियां दी कि नहीं, उसको बाजू पकड़ी कि नहीं, उसको प्यार से किया कि नहीं, नर्चर किया कि नहीं, it is up to you how you do that. But if you are not handling that patient properly, if you are in a hurry, if you don't want to spend some time with the patient, then you are actually at fault. You're closing one big door of your income. Patient conversion is one of the important steps to case acceptance. And all that starts with the consultation. अगर आप वो नहीं कर पाते, consultation means communication. If you can't do that properly, if उसके बावजूद आपकी प्रैक्टिस बहुत अच्छी चल रही है, तो रोज मंदिर जाके 11-21 रुपए का प्रसाद चढ़ाया करिए. This is my best advice to you, because then you are just lucky that if you are having that. So then again, the second step is to credential the clinic, dentist, and procedure so that the patient can understand the clinic's value proposition. What your clinic stands for, what are your clinic credentials, and what you can offer as a service, as a sale, as a procedure, as a treatment, as an option. Then finally, the clinic should close the appointment by gathering all the patient demographic information. This is the way to actually, you can say, make the 3 C's for making the appointments. The patient कितनी दूर से आएगा, किस तरह आएगा, कौन सा टाइम सूट करता है, उसकी कितना, क्या मोड ऑफ कम्युनिकेशन है, क्या मोड ऑफ ट्रांसपोर्ट है, क्या जॉब की प्रायोरिटीज है, कितना लेट होने के चांसेस हैं, कितना उसका फैमिली टाइम के साथ है, ऑल दो थिंग्स, कितना आपके टाइम के ऊपर एक्स्ट्रा के ऊपर इंक्रोच कर रहा है, all those things have to be taken into mind. That is the reason I always suggest give your appointments yourself. Don't let the receptionist do it. If you're doing it, perfectly all right. If you've trained your receptionist, perfectly all right. But I believe that this is the best way that you can actually control your conversion thing to a great deal in your practice. You need to understand that if you are doing that or handling that properly, you can actually control a lot of things in your practice. So tip number 13 is explain fee and payment before the start. It anyways is very important to provide payment woes at the end. The consultation always involves, along with the consent form also. I make it a point to guide all my colleagues in my consent form workshops that always take the detailed breakup or the total treatment part, how the payment is to be paid, a signature thing. Of course, the consent means the first, the verbal one, and then the informed one. All those things, how they are to be paid, why they are to be paid. In the detailed practice management, I give a breakup of everything, how you have to charge at each and every procedure. If, for example, if it is a 20,000 case, how you have to charge for that. Some of the people who attended my lectures and workshops full day, they know it, how I do it. But then you should have a fee detail prepared. You should be ready with the estimates or whatever. If the patient wants, you can provide a breakdown as well. But don't, whosoever is not your patient yet, don't write on your prescription pad. Just write on a plain paper. Once the patient has signed on the consent, is ready to start the treatment, is ready to start with the, you can say, procedure, has paid the advance, you can give the breakup on the detailed breakup on your prescription pad as well. So sometimes the patients, आप अपने staff के साथ consultation कर रहे हैं, always say consultation जब करनी है तो it should be without your staff. Obviously हम कोई physical examination तो कर नहीं रहे हैं कि कोई female या male member की presence जरूरी है हमारे साथ. Because sometimes patients are too embarrassed about payment options कि third person के सामने कैसे discuss करें. Offer it yourself. The ease of convenience. Whatever you do, it is going to actually make a conversion. Trust me, a patient actually refused me a treatment. It was my old patient, had gotten all treatment done from me. But once his time for big ticket procedure came, he said, उन दिनों में मेरी credit card machine had gone for replacement. And the bank had already told me it will take about 3 to 4 weeks. The day actually the treatment was supposed to be finalized, the parent says, I am not ready to get the treatment done because you can't, you are not able to take the procedure, the payment from the credit card. I said, ma'am, it will be available in 3 weeks, as the bank says. So the treatment was going to last 1.5 to 2 weeks only. But yes, I lost a patient because of that. A very stupid example on, you can say, on part of the patient. But yes, this thing has also happened. This makes me believe more that yes, more convenience options should be given to the patient. Remember, that was a time of no digital payment, no UPI, no GPay, PhonePe. I'm talking of 10 years back. It makes patients more financially comfortable also that they are able to pay in a convenient mode. Obviously, if you have done and discussed the treatment part, it saves the payment woes also at the end, most of the clinics. So then follow up with procedures passionate with your patient passionately, like you do the procedures. Follow up is very important because it creates your value in patient's mind. Yes, doctor is there for me. He cares for me. फिर वही बात, call rate are dirt cheap. Just make a call. Make your staff make a call. Any problem, we are there. Just let us know. The patient should not feel doctor ने हमें रास्ते में आगे छोड़ दिया, कर दे ट्रीटमेंट, पैसे ले लिए, ना पूछा ना वास्ता. It just adds to a care factor what you're doing. So the final thing is always track the progress or the conversion rate. Dig deep into the record keeping. जो conversions हुई हैं, जो नहीं हुई हैं, कितनी हुई हैं, measure तभी करेंगे ना 72 out of 100 अगर आप calculate करेंगे. So always set a percentage goal कि इस महीने इतना है, next month we want to improve on this percentage. It's never too bad. If you're starting from 40 out of 100, I don't mind that. But the next month should not be 39. It should be at least 42. That is what I want. Again, a quote for this: history always digs out treasures. If you believe and you are doing a proper record keeping, analyzing it, that is the way to actually grow about it. So coming to the end, let's summarize today's presentation. What are the main ideas behind today? So we all know that paid advertising and effective closing skills, you can say the dental practice is going much beyond that. What as create success are the assumptions. Doctor का brand है, doctor का नाम चलता है. So those things are just going to be, you can say, a part factor in conveying what the patient wants. The most important thing is to let go of the arrogance. As I said in the beginning, some people say we convert 100% of our patients, which is not practically possible. So it also speaks, we don't call back. We are doctors. हम patient को call क्यों करें? Is the patient a class 4? No. He's like a god to you. He's giving you money after God. So he should be, you can say, he should be your Aradhya Dev. He should be worshipable. He should be puja in that sense. Not literally, I mean to say, but what I mean to say is, if somebody is giving you money and food, it is the patient after the God. So you need to respect that thing. But if you have a doctor or a God phenomenon in yourself, you're going to go that. And arrogance comes in many forms. I will decide. I am the dentist. Somebody suggests you a Google treatment plan. You can refuse it in a politer way also. Or you want to make the patient. I've seen colleagues, not one but many, जितना patient को इंतजार करके अंदर बुलाओ ना, उतनी डॉक्टर की कदर ज्यादा पड़ती है. Bullshit idea. Stupid and bullshit idea. May have worked 20 years back. Does not work today. Nobody bothers. They have too many options. आगे 1 स्क्वायर किलोमीटर में 2 डेंटिस्ट होते थे, 20 हैं. Nobody will bother. जितना मर्जी बड़ा नाम हो, 1 बार 2 बार 3 बार वेट कर लेगा पेशेंट, चौथी बार नहीं करेगा. आई एम सेइंग मोर, 3 बार भी नहीं करता लोग. That is where you actually say consumers assume a doctor's technical competence, but similarly अब कोई पायलट से जाके तो पूछता नहीं ना रनवे से पहले, पायलट साहब उड़ा लोगे ना, पक्का कितने उड़ाए प्लेन पहले आपने. they won't ask a pilot, they will just board the flight, आंख पे लगाएंगे, बेल्ट बांधेंगे और सो जाएंगे. अपने आप उड़ेगा, जब उड़ जाएगा तो वो एयर होस्टेस उठा देगी, कोई बात देखी जाएगी. People use the flight as a mode to catch on their sleep. Nobody goes to the pilot room just after entering. Air hostess आपको welcome करिए, welcome sir to the flight. Is this ways? Okay, नहीं मेरे को इधर जाना, पहले मेरे को पायलट से मिलना, उसको पूछना है उसकी कितनी फ्लाइट्स हैं आज तक. If the pilot से मेरी पहली फ्लाइट है, तो will you deboard the flight? No, you won't. So similarly, somebody who's walked in through your door, he has a faith in your credentials. He trusts you in and your abilities. He's come as a referral majority of the times. So you need to at least do and done away with that part. हो गया ना? They have selected you. अब आगे आपके credentials हैं. People will say डॉक्टर का काम अच्छा होगा, बोलने की अकल नहीं है. डॉक्टर का काम अच्छा है, थोड़ा सा महंगा है, बट सर्विस बड़ी अच्छी है. Negative things will get, you can say, set in the carpet. They'll be like that only. But the communication will become basic. पैसे भी इतने ले लिए, काम भी ढंग का नहीं किया, इतनी देर वेट भी करवाई, और बोलो तो कुछ कहो तो हमारे पास तो ऐसी है जी, हमारा तो टाइम लगता है वेटिंग का, हमारे पास पेशेंट बहुत है, हम ऐसे ही कर देंगे अटेंड. दिस इज एरोगेंस, प्लेन एरोगेंस. यू नीड टू गेट रिड ऑफ इट. द पॉइंट्स इन पेशेंट्स माइंड, We colleagues call them soft skills also. Many mentors will call them soft skills also. Patient के मन में क्या आता है? मेरी बात सुनी गई? Was I listened to? Was I given every opportunity to ask questions? Were those questions answered? Does this feel like a safe place? Is this the dentist I can trust? And out of these three, I always add these three in my consent forms as well. This is the way you can, if the patient has answer to all these 5 questions in affirmative or yes, the patient will always choose you as a dentist. And if he chooses you as a dentist, that means the conversion happened. The case acceptance is done. But yes, behind all this, you need to have the primary skill. The primary skill that you are a good dentist. If you have the good skill, then only you can give a good treatment plan. And then only those treatment plans can be sold. But the basic deficiency in the skill part is there. Nothing marketing, internal, external can cover up for that. So I believe that that skill is already there with you. These all things come after that. So do not underestimate a patient's ability to focus on these issues, especially these 5. They will always make the difference between a yes or a no to the request for a commitment. And mediocre skills will induce a mediocre response. कोई बात नहीं डॉक्टर, मैं सोच के बताता हूँ. मुझे ना फैमिली से सलाह करनी है. मेरे पापा आज थे नहीं टाउन में, वो आना चाहते थे, मैं उनसे बात करूंगी. And let you know, if you are doing a mediocre consultation, you will get these answers only. And somebody would disagree, some colleagues would disagree. नहीं, वो बहुत बारी हमने प्राइस ज्यादा दे दिया ना, इसलिए उन्होंने फैमिली से बात करनी थी. Then you call up the patient. डॉक्टर मैंने सोचा था, बात किया था, वो ना कह रहे हैं कि थोड़ा सा ना चार्जेस ज्यादा. Nobody will tell you the right excuse. They might have different thing. वो डॉक्टर के मेरे को कॉन्फिडेंस नहीं था, उसने मेरे को ट्रीटमेंट प्लान बताया, उसके हाथ कांप रहे थे, वो ढंग से नहीं कर रहा था, बार बार घड़ी देख रहा था, इधर उधर देख रहा था, आंख में आंख देख के उसने बात नहीं की मेरे से. जिसको काम आता होता ना वो इतना इधर उधर नहीं देखता. People have so many criteria to judge you. You don't even know. Your body language plays a lot of role in that. How you convey that plan. And trust me, these things cannot be negated. These things are not very difficult to be negated, difficult to refuse in that sense. People, colleagues say they are dentist or they are patient centric, but उनकी convenience होती है कि मेरे consultant, मेरा staff आ जाए, patient जाए भाड़ में. They are not really bothered. You need to have that approach as well. The patient centric approach होएगी, so these things will automatically be taken care of. The consultants will be on time. The staff will ready the things before the patient arrival. This approach is good enough. And if this approach is good enough, patients will pay you also. You will be one of the most busy dentists also, and they will choose you as their primary dentist also. अब इसका रिवर्स सोच के देखिए ना, गंदा सा वेटिंग रूम हो, खुद अपॉइंटमेंट पे हम लेट आ रहे हैं, पंक्चुअलिटी की कोई नहीं है, पेशेंट आगे बैठा हुआ है. अब पेशेंट लेट आएगा तो तमाशा कर देते हैं, आप लेट आए हो, जैसे आई टोल्ड इन यस्टरडे पंक्चुअलिटी सेशन, हम ट्रीटमेंट नहीं करेंगे गुस्से में, लाइक दैट. पीपल डू इट इन अ वे, दैट इज देयर ओन पर्सनल चॉइस. देन लास्ट मिनट लैब डिलेज हो गए, लैब के साथ कोई है ही नहीं है, क्योंकि लैब हमने 2 महीने पहले चेंज की थी. दे डोंट नो आवर वे ऑफ वर्किंग. लैब इसलिए चेंज की थी कि उनका 50 रुपए पर यूनिट चार्जेस कम थे. अ स्टूपिड एक्सक्यूज टू चेंज अ लैब. इवन अ लोकल लैब 50 रुपीज, 20 यूनिट के पीछे 1000 रुपए अ मंथ. एक पेशेंट भी गया, सब पूरा. यू नो दैट. स्टाफ इश्यूज, मेकिंग द चेयर रेडी, स्टाफ डिसग्रंटल्ड है, हमारी तनख्वाह तो 4 साल से बढ़ाई नहीं है, खुद देखो कितने पैसे कमाई जा रहे हैं. People will have all the notions and opinions about you. You are in a very very difficult situation if you are a clinic boss. वो नायक मूवी का डायलॉग था ना अमरीश पुरी का, एक दिन मेरी जगह पे आके देखो कितना कांटों का ताज पहनता हूं मैं अपने सिर के ऊपर. This is the way you are wearing. If not the Game of Thrones, you are wearing a crown of thorns. Thorns, sorry, not thrones, sorry, crown of thorns. So this is the way you need to realize that you are in a tough situation, but yes, nothing comes easy and free of cost in life. You are the one who is carrying out the meatiest portion of the income of the clinic. Rest all get peanuts out of the total portion of you have earned. If your gains are, you can say, hefty, your criticism, your handing also has to be hefty. Your responsibility has to be hefty. With power comes great responsibility. Spider-Man said it, I didn't say it. So remember that. So these cues will communicate that you are more important than the person you are serving. Unintentionally, they may convert it. So they may be interpreted differently by the patient. आजकल के customers, consumers, patients are very demanding, and they will not follow what worked 20 years back. So अब वो ना घिसी पिटी लव स्टोरीज जो चलती थी बॉलीवुड में वो भी नहीं चलती हैं. डीडीएलजे जैसी पिक्चर आज रिलीज होगी तो शायद सुपरहिट नहीं होएगी जितनी वो आज तक हुई है आज के टाइम में, बिकॉज पीपल आर नॉट बॉदर्ड ऑफ नॉट लाइकेबल टू वॉचिंग 3 hour मूवीज. वेबिनार्स भी कोई नहीं देखता है. 2 मिनट का किसी को वीडियो भेजना वो भी आगे आगे कर करके देखेंगे. पेशेंस ही नहीं है, टाइम ही नहीं है. प्रॉब्लम इज देयर ओनली. So if you want to improve your conversion rates, घिसे पिटे idea of your 20-year-old father or maybe 20-year-old any colleagues, any senior colleagues practice have to be rehashed now. I'm not saying totally discard them. They have to be rehashed now. Some have to be like an old wine in a new bottle. Some have to be packaged well, while some have to be, the wine has to be totally changed as well. It does not work that everything works as per the change of the wine, but certain procedures, horses for courses. The situation demands it and you work it accordingly. Ultimately, the only one thing which will remain at the end of patient treatment is, does the thing enhance the patient experience? वही लाइन जो मैं हमेशा से बोलता हूं, how was I treated? ऐसे भी और वैसे भी. That is what will make a difference in the patient's life. ऐसे भी means treatment wise, वैसे भी means behavior wise. If you're not treating the patient well, they are not going to come to you further. And retention of the patient is one of the important reasons of growth of any practice. Any one of us who underestimates the starting consultation and the retention and is interested only in sale and not service is digging a grave for himself or herself. That is the prime thing you need to understand. So change whatever does not work for you. Each refinement, even if it is a small one, will be worthwhile, because it may be easier for the patient to say a yes during the consultation, because the total experience is, हाँ यार, time पे देखेंगे, wait नहीं कराएंगे. The doctor talks well, he knows his job well, सारा procedure तरीके से समझा दिया, and every detail has been given. Payment थोड़ी बहुत ज्यादा कोई बात नहीं, adjust हो जाएगी, पर इन सारी conveniences के आगे payment कोई बात नहीं होती. Obviously, you will not be double of your colleagues in your area. You'll be a tad more, maybe 10-20% more. But that does not give you the license to eliminate other important things. So treat every patient like a VIP if you can, because that is the mantra to success. So I hope I have not much gone beyond the scheduled time. Yes, almost on time. So all my presentations will always have the last few slides as carry home Gyan. So all those 15 tips that I've given you are actually designed to improve your first patient consultation process, because that will increase the conversion rate in your practice. And trust me, if you adopt them well, the overall quality of communication can also be elevated. So you all can have more opportunities to build rapport and form rather than कि मैंने ये किया, मैंने वो किया approach. Once जब patient ज़्यादा आएगा तो बहुत सारी reputation और build करने के मौके मिल जाएंगे. बट कंसल्टेशन अगर पहले भी सही नहीं होगी तो वो दोबारा ही नहीं आएगा, तो कहां से रेपुटेशन बनाएंगे आप? सो व्हेन पेशेंट्स फील दे हैव एन एक्सपीरियंस और अ ट्रस्टेड लाइजन इन द क्लिनिक, दे गेन द कॉन्फिडेंस एंड दे विल मूव फॉरवर्ड विद द सजेस्टेड ट्रीटमेंट प्लान. वी ऑल, every clinic, every dentist would want to work towards patient satisfaction, but the patient needs to know more than what you can just offer. So why it matters to them, and why should they take the next step to choose you as a primary dentist? So good consultation is the first step of a series of many steps which are designed to improve those strategies or those processes which can make the process of that stranger who has walked into your practice to make that or make him or her as your patient. So to change your life is deciding it is time to step up and just do that. So do just that. Be a go-getter. So if you focus on where you want to go, and where for that you need to know where you are, and then you focus on where you want to go and not what you fear. Just try understanding the difference between the two things. So Benjamin Franklin may have discovered electricity, but it was a man who invented the meter who made it a real fortune. बिजली का मीटर जिसने बनाया, पैसा उसी ने कमाया. So efforts in the right direction can help the person climb higher. So your efforts, if you are giving towards creating your brand only externally and doing nothing internally, trust me, you're not doing even 1/3 of the job properly, because the 2/3 of the part will still be in your clinic. So thank you so much for a patient hearing. I stuck to my time of 70 to 80 minutes, I guess. So this is my YouTube channel link. Uh, Going by my name only, Dr. Bhavdeep, youtube.com/c Dr. Bhavdeep. So if you forget the link, go to YouTube and search for Dr. Bhavdeep Ahuja. You'll find my channel, subscribe and hit the bell icon. I keep on posting videos twice every week minimum. As on 31st August, there are 375 plus videos. So you can watch those videos taken as a part of my payback to the profession to serve the dentist community. So this is my KYC, my email address, phone number. You can get in touch with me. So this is my social media presence, all by my name, Dr. Bhavdeep, except the page, which is Dr. Bhavdeep Ahuja. So if you want to read more, I've been writing a column in Idea Times since past 5 years now, almost 5 years. 5 years will complete in December 2021. 57th part was published in September 2021. So I have 2 WhatsApp groups also, which are functional. The 6th group is on if you want to be added. Again, this is also my endeavor to get back to the society, which has the profession, which has given me so much. So if you want, there is no other admin. I am the only admin. Just send me a message. I'll add you. But they come with a set of rules, which you have to follow. So please send me your valuable feedback on my cell or on the page or on the WhatsApp group, wherever you are. So bookers and brickbats both would be welcome in equal measure. So thank you so much once again. And I stop my share for the question time, firstly taking up from the chat. Okay, Dr. Divya asks, what do you mean by don't simplify content too much? I think Dr. Divya explained that don't go into the too much detailing of the treatment plan, because that is, if those things are usually taken care of. Just ask the patient if he or she has been concomitant or known to the treatment plan. So if the patient says yes, if you want to ask, learn anything more, or we move on to the other discussable things in that. So Dr. Sabyasachi asks, is it necessary to call a patient after impaction, surgery, or RCT appointment? I think Dr. Sabyasachi already answered that. Yes, it adds to the care factor if you do that. There is nothing wrong in calling back. It is not a matter of ego. It's a matter of showing your care and sympathy or empathy for the patient. So Dr. Harshada asks, should patients who have come for 2 consultations and seem ready to start the treatment be called up to schedule appointments? I mean, she said, I am ready for treatment and its cost. I will discuss with my husband and call for scheduling the appointment. Should I call her and ask her about her confirmation? If the patient said yes, then you surely can call the patient once at least. Make sure that you call yourself, not your staff, in this regard. So it does not bode well if the staff, because you have communicated, you have talked out with the patient. So the patient understanding, you know better, because the patient might want to say, प्लीज जो आपने मुझे बताया था एक बारी मेरे हस्बैंड को भी बता दीजिए. There are many times similar situations, so the staff may not be able to help in that regard. So do that yourself whenever you have time. Don't call when the patient is there sitting in the chair and you try to call the patient in that regard. So always have some free time when you do that, because the conversation might go on a little longer than expected. So I normally call up the patient after 2-3 days. Yes, fine, perfectly all right. If the patient does not take the appointment in 2 to 3 days, it is wise enough to call at least once. So, okay, thank you, Dr. Divya. So what should I do when the patient does not answer the call twice? What sort of patient are you referring to, Dr. Divya? Similar to one, if Dr. Harshada mentioned, if that is the case scenario, then I would say drop a message. I called you up twice to schedule your appointment as we discussed. If the patient still does not answer, forget it. I will not, you can say, just don't go by the push strategy again and again. It was your duty to call and send a message, but don't go beyond that. Don't go overboard in that. In Dr. Harshita's case, for example, I've chosen the scenario that the patient himself or herself said that I'm ready to start the treatment. I just want to talk to my husband once. And maybe the husband might have refused, or maybe the husband might have said, we are running short of money right now. maybe we can reschedule it in a couple of months, a couple of weeks, or whatever the situation. Maybe the festival season is coming, whatever excuse can be there, and it is usually the females who have to make the sacrifices, and sometimes those reasons are genuine as well. So try understanding that it is not always that the patient got a lesser known treatment or lesser cost treatment plan, so he or she has dropped you. There might be some genuine reason. There might be a certain incidental expense coming up on patients, and which might have forced them to postpone the treatment by 2 weeks, and they might be feeling you can say not very comfortable telling you the correct reason. So they might say, oh, no problem doctor, I will take the time, I will call you up. So when the patient says, I sometimes try and understand that this can be a double-edged thing. And trust me, many of such patients have rescheduled their appointments themselves with me. So there is no harm in calling up once or dropping a message once, but don't go overboard in that. But yes, if the patient still does not take the appointment, try being in their shows. Maybe genuinely they are delaying the treatment for a very specific reason, which sometimes the wives don't know. The husband might be aware of that. So I hope you answered your queries. Okay, similar case. Thank you. Any more queries from those who are present here? Done. Okay. Okay, guys, then I won't come between your dinner and your sleep and yours. And this session already is overboard by 15 minutes or so. So I'll try to limit it to 60-65 minutes by next time. So do drop me your feedback, whatever you felt, any learnings from here. As I said, a similar topic was there on conversion, but yes, a lot of content was different from that. So surely I'll be welcome. So the next session would be next week only. Again, I'll try to stream one on WDA and one on DADS platform, along with, of course, the Zoom room would be open for the paid group members for sure. So thank you so much. Have a great weekend and enjoy your food and enjoy your sleep. If not taken already, I mean to say the food. Great. Thank you. Take care. Bye-bye, guys.